Welcome back to Ask Dr. Abair. The outbreak of this virus has affected all of us in some way, whether you were infected, witnessed the death of someone close to you, or maybe even lost your job. One thing everyone can agree on is that it's caused stress on everybody's mentality. Now imagine being a teenager or a kid during this pandemic. Dr. Abair, I'll just hand things over to you because I know you have a special guest to help us understand what's really going on in the minds of our youth right now.
Yes, thank you, Travers. Tonight we're joined by Dr. Ryan Pasternak, professor of pediatrics at LSU Health and Adolescent Medicine at Children's Hospital. Dr. Pasternak, thank you for joining us tonight. And the first question, how is this pandemic affecting adolescents?
Yeah, I think that's a good question. Adolescents tend to be fairly resistant, but a large part of adolescent development is related to social interactions and their development of relationships. So it's hard to do that effectively, via the internet and on Zoom. As pediatricians, we're worried about mental health, preventive care, and missed screenings for adolescents. So we support parents in having conversations with their adolescent children about how they're doing, asking where they may need more support, and ensure they get preventive healthcare services.
Well, Dr. Pasternak, how can young people replace the support they typically receive in their usual social settings while still maintaining this social distancing?
Personally speaking, my son has his birthday this week. He's a tween, and we've struggled with how do we both maintain safety in the context of COVID-19, as well as provide him some social interactions. So 2 friends are coming over with parents. We're all socially isolating in the front yard, and we're gonna have pizza and cake, but in a very specific way to maintain safety around COVID, wearing masks when not eating, etc. But we also feel that the internet has been his closest friend during all of this, and that's not an effective replacement. So I think looking for opportunities for adolescents to interact with one another, recognizing that friends are their main source of social support, and having parents talk to them about that, and coming up with creative ways to interact with one another is going to continue to be really, really important for all of us and for adolescents specifically as they go through this developmental phase.
Before we let you go, Dr. Pasternak, any advice for parents moving forward to address concerns and anxiety of the possibility of returning to school? Like when they will return to school, or when will things go back to normal? I'm sure kids have a lot of questions that we don't necessarily have the correct answers to, and parents and adults, I'm sure, have those same questions right now.
Yeah, I think that's a really good point. I think talking to them about that anxiety, seeking out care and making sure that they do get professional help, whether it's from their primary care pediatrician or from a mental health specialist like a social worker or counselor or psychologist or psychiatrist, to do further evaluation and see if there's something there that really needs to be more effectively treated. We've seen reports of increased opioid use and overdose among adults during this time. Most adolescents tend to use substances recreationally with friends, so that may be down a bit. We're waiting on that data. But adolescents also use substances to self-medicate for depression and anxiety. So it's really going to depend on the degree of parental monitoring and access that they have to alcohol or drugs and some of these other factors. And I've worked with a number of patients over the last few months to try and transition them from using marijuana or alcohol to more effective ways to treat their anxiety and depression, like medications and therapy.
Dr. Pasternak, I want to thank you so much for joining us tonight to give us so much great information.